Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists dental associates with employment contract and independent contractor agreement issues. Today I'm going to talk about practice purchase agreements. So if you're a dental associate and perhaps your employment contract states after a period of time, the practice will then determine if they're going to be offered partnership or not. If you are offered partnership or some kind of stock purchase, what are some things you need to think about and that need to be discussed in advance or contained in whatever kind of purchase document you're going to sign. So first, determining the structure. So is it a stock purchase agreement? Is it just a equity share? Is there a buy-in? Are you just given ownership in some way? It can be structured 100 different ways. And so figuring out what is the structure that they're offering you, it's going to be the same as whatever it is for the other, owners in the practice. Generally, they're just not going to give you something specific to what you want if it's different than what the rest of the partners have. So first, determine what type of purchase agreement it is. Valuation methods. How do you value goodwill, equipment, patient charts that you're bringing perhaps from your current practice, or if you're a part of the practice that you're with as well. These are important things, especially if you're buying into. You want to know what you're buying into. You want to know what you're bringing with you. And so it's important to kind of have an understanding of how things are valued. Liability allocation, the debts, the liabilities, are they transferred to you as the buyer? Are they apportioned differently for the existing owners of the practice? Once again, these are things that need to be discussed. Your transition obligations. So during the transition period from when you're a dental associate to becoming an owner, are your responsibilities changing? What are the kind of allocation of your responsibilities once you become an owner? This should be discussed in advance. And then many times there'll be some kind of restrictive covenant, so a non-compete, a non-solicit associated with you becoming an owner. Perhaps it changes after you become an owner from what you were as a dental associate. So what would normally happen in practice is you'll have an employment agreement as a dental associate, and then once you become an owner, you would generally sign a different type of employment agreement. The compensation structure usually changes. Maybe if you're a dental associate, you're paid a daily rate, or some kind of like hybrid of daily rate or percentage of collections, whichever is greater. Normally, as a practice owner, it's purely some kind of percentage of whatever you bring into the practice, and then you split the profits equally if maybe you have your own labs or any kind of ancillary services as well. And that's why you would become an owner, is to make more money. Obviously, it doesn't make a ton of sense to buy into a practice where you're either making the exact same amount or less than you were. But then you also have the opportunity to, become an owner in the buildings and kind of the other potential money-making opportunities as well. It can be a little scary as an associate to enter into an ownership, and there are places that I've seen that have attempted to kind of take advantage of the dental associate through some kind of insane buy-in. I would say it's probably more common than not that most associates don't have a large buy-in anymore. I'd say 10 to 15 years ago it was much more common to have a very large buy-in, and then normally it would be you'd get some kind of loan, or they would just take it out of your future compensation for a period of time. But just to expect you to plop down a huge amount of money to buy into a practice is just kind of not the way that it's done regularly. Not saying there aren't instances where that happens now, but it is relatively uncommon nowadays. Now, the other thing I want to talk about is the specificity of the kind of buy-in or stock purchase or whatever you want to call it as a dental associate in your original employment agreement. It's like promising to marry somebody in 2 years. You're just not going to be held to it. So if there's any kind of language in your contract at all, it's going to be something of very general of after a 2-year period or a 3-year period, the practice will discuss ownership opportunities, at the time if desired. You're just not going to get a guarantee or really any specifics about what the buy-in would be. Perhaps they want to change the way that they structure the ownership or practice over the course of the 3 years. And they're not going to want to be locked in to whatever it says in your employment contract. So don't take it as a red flag that there aren't any specifics as far as what the buy-in will be once you are offered partnership. Now, last red flag. Some places they'll dangle the carrot of ownership as a means to depress whatever your compensation is in the first few years of employment, meaning they're going to pay you under market with the carrot of becoming a partner down the line. You want to be very careful that they're not doing this as just a way to pay you less for the first and then not give you any kind of offer into the practice. So I would ask questions. How many other associates have you employed? How many of them have you offered partnership to? How many have you denied? Get into the specifics of it and see if there is a pattern of them kind of abusing. I mean, maybe that's a strong word, but using the means of becoming a partner as a way to depress the salary of the dental associate. All right. If you have any questions about your employment agreement or independent contractor agreement, or perhaps a potential, practice purchase agreement, you can contact my law firm in the information listed below in the description. And I appreciate you watching the video. All right. Thanks. Take care.